The movement competency screen was designed to be a prognostic screening tool to assist sport and health professionals better understand how an individual performs movement tasks commonly prescribed in strength training and rehabilitation programs. The MCS is comprised of movement tasks that progressively challenge how a person squats, lunges, pushes, pulls, rotates, bends, and single leg squats in both bodyweight and bodyweight plus intensities. The MCS scoring is associated to the 5 loading methods commonly used in strength training and rehabilitation. Level 1, assisted bodyweight. Level 2, bodyweight. Level 3, external load at slow movement speeds. Level 4, eccentric. And Level 5, plyometric. The scoring was designed specifically so that the screening results for each pattern can more intuitively guide the strength training and rehabilitation process. By implying that the load level given for a particular pattern is the load level the screener feels most comfortable challenging the individual with until the individual's movement competency improves. The remainder of the video illustrates the MCS. The athlete in the video does not move perfectly, but does demonstrate how each MCS movement task should be performed. It is recommended that individuals perform between 2 to 10 repetitions of each MCS movement task. Ultimately, the number of repetitions selected should be influenced by the capability and capacity of the person being screened. Movement 1A, the squat. Hold the fingertips on the side of the head. Try to keep the elbows in line with the ears. Squat as low and as comfortable as possible. Movement 1B, counter movement jump. Same setup as the squat. Try to jump as high as you can. Movement 2A, lunge and twist. Hold the elbows up. Step out as far as is comfortable. Rotate into the lead leg. Lunge with the leg closest to the camera. Movement 2B, lunge and twist as fast as possible. Lunge out and rotate as fast as you can. Movement 2C, broad jump, 2-foot takeoff, 1-foot land. Hold the arms in a free position. Try and stick the landing. Jump as far as is comfortable. Movement 3A, the push-up. Movement 3B, explosive push-up. Try and get air between your hands and the ground. Movement 4A, bend and pull. Hold arms straight overhead. Bend forward to a comfortable depth. Pull your hands into your stomach. Movement 4B, bend and pull as fast as possible. Same movement, just fast. Movement 5A, single leg squat. Fingertips on the side of the head. Elbows held in line with the ears. Squat as low as is comfortable. Movement 5B, single leg counter movement jump. Jump off 2 and land on 1 leg. Jump as high as you can. Try and stick the landing. Now that you know what the MCS entails, using the MCS is as easy as 1, 2, 3, 4, and 5. Have an individual perform each of the MCS movement tasks and simply assign a load level you believe the individual's movement competency can support. Ask yourself what load level you believe each pattern can handle based on how you observed the person perform that pattern. Generally, the movement strategy an individual demonstrates when they perform the MCS movement tasks is the strategy that is the most comfortable or the way they know or have been taught to move. People move toward strength and away from weakness. Therefore, although you may be able to correct their movement strategy on the spot, you have to consider how they would naturally move when you are not there to correct them. Some people may need time to change their movement competency, and others may respond to coaching within 1 or 2 sessions. Regardless, the MCS is a tool for you to identify a starting point for the athlete, client, or patient to begin their journey to a better physical well-being. Lastly, an individual does not need to perform all of the MCS movement tasks for you to understand their movement competency. If they struggle to perform a bodyweight squat, then there is no need to have them perform the counter movement jump, as they will only accentuate their movement incompetency and potentially hurt themselves. Only have a person perform the more dynamic bodyweight plus MCS movement tasks if you believe their movement competency for that pattern is at least a level 3, and you want to better understand if they have the movement competency to handle plyometric training, level 5, or if time and attention needs to be directed on eccentric, level 4 training, so they can better control the landing of the explosive upper or lower body exercises you may want to prescribe. Thank you for your interest in the MCS. We hope the MCS can help you better understand how your athletes, clients, and/or patients move so that your training or rehabilitation prescription is a success.